How many of you have a friend or a family member or someone whom you know who has cancer or who has survived or died of cancer? Okay. Actually, I'm surprised that not many hands went up. Maybe because you had a high-carb breakfast. You're so tired to raise your hands. Maybe because you are shy. But it's very common. So I'm going to talk about cancer. This lecture is going to be slightly different. It's not going to be focusing on the current treatment. I would like to give you a knowledge what has gone wrong with the treatment. Okay? So that means I need to talk about history. I need to talk about, some of the best brains in biochemistry who laid the foundation as early as the early 19th century, but it was always swept under the carpet, not recognized, and somebody had to work very hard to revive these theories to give us a better understanding. So many things that happen in scientific world shouldn't have happened. There are some good things, but many such things. Cancer is a typical example where science has gone wrong. So I'll give you this. We'll go through about 20 slides on history. It's good to know. You have to appreciate those who have done the best work, right? And I'm just standing here vomiting out all those knowledges because I didn't do this work. At least somebody has to pay homage to all these great brains, great souls. So it's going to be a lecture on cancer, the ultimate truth, but it is not the only solution. I'm going to focus mainly on diet, but it is not the only way to conquer cancer. Okay? Now in USA, 4.3 million new cases in 2014, 2.8 million deaths in 2012. In China, reported to be 12,000 new cases per day and 21,000 new cases worldwide per day. Okay? So that's a lot. That's what I said. I'm surprised not many hands went up. The risk of cancer in lifetime is generally 1 in 3 to 1 in 4. By 2025, it's estimated to be 1 in 2. Okay? So is it something that you need to be concerned for yourself, for your family, for your friends? Yes. And you should be concerned about your children. I'm sorry to say this. These are just facts. Sometimes these facts can be very bare and very hurting, but it's better you face the reality now than to have someone you love to be suffering from cancer. Children are already dying before parents. So unless you face the facts, you will not brace yourself to face the challenges. Okay? Now, cancer is a multifactorial disease, so we call it an ecosystem. So it is not just one cause, multiple causes, and cancer has something to do with the Darwinian selection. You know the Darwinian principle, where each generation, the best survives, the fittest survives, and you have mutations, they are not polymorphisms, a change in the genes to help you to survive in the new surroundings. Then the fittest is selected. Okay? So life evolved from a very simple organism to a very complicated organism, that is us. So there was a change in the way energy was created. But we have the genes or the rudimental system in our body, and if you change the way you burn energy or the food you eat is different, then the rudimental system gets activated. So that is the crux of the story. And one point that you should concentrate is mitochondria and energy production. If you understand that, I think you will understand cancer. Okay? But again, this knowledge or this thinking may change, but I think the best thing has happened so far in cancer from 19th century onwards is the understanding of what happens in a cancer cell. So I probably think that you won't go much further from this. Okay, so this would be the ultimate fact or ultimate truth. So in order to change that, you have to change the entire environment. So it is not a single modality of treatment. Let it be conventional or... Are you recording? Excuse me. You can put it down if you're not recording. Can you put it down, your camera? Yeah, put it down, please. That would be fair to all of them. So it's an ecosystem. So you need to look at the entire environment if you want to help the patients to fight cancer. But keep the knowledge and understand this so that you can help yourselves and everybody I told you around you, those whom you love and care, to prevent cancer. Now, 95% of cancers are due to diet and environmental factors. Genes do play a role, but genes are mostly what we call as loaded guns. You have to pull the trigger. It's just loaded. It is sitting there. The trigger is what you need to understand. What pulls the trigger? It could be stress, it could be your diet, it could be deficiencies in nutrients and hormones, or it could be excess in hormones, multifactorial. But do not keep blaming the genes entirely. They play a very small role. That is why I wanted to go through the history. Otherwise, we'll be constantly bombarded with knowledge that gene therapy is going to fight cancer. Vaccines is going to cure cancer. It is difficult to accept that if you understand why the cells become cancerous. And remember that 70% of our immune system is in the gut, and you have more bacteria than your own cells. So you are actually outnumbered by 10 times. You have more bacteria in the gut. So you have to respect the microbiome. And the biggest problem that we have brought upon ourselves and our children, our patients, is the indiscriminate use of antibiotics, because you just destroy the ecosystem in the gut. I myself, for those who are here, I'm a good example. I started having sinusitis as a medical student. I was taking antibiotics. Then I became expert in antibiotics, okay, whereby I was taking injectable IV, and that was IV Rocephin, very strong. Okay, and I had 7 surgeries for my sinus. And these are all experts. They are very good ENT surgeons, but they meant well. You know, nobody wanted to harm me. None of us want to harm the patients, you know. It is the lack of knowledge and awareness that you are giving the wrong treatment. None of us want to harm. We are not bad people. We are all good souls. But the treatment is wrong. So I took all this and I developed systemic candidiasis. Then I went on to get aspergillosis. It's like an HIV patient, you know. Everything was just wasting away, rotten. And I was very, very sick. This was about 20 plus years ago. And that is a time I asked myself, what am I doing to myself? If I can't treat my simple problem like sinusitis, and treatment has complicated my life so much, how can I help my patients? So I started reading about diet. Then I felt better, but it wasn't sufficient. Then I had to read about nutritional medicine. Then I acquired my knowledge, and then I put it to myself first. I always try, except estrogen I don't take. Otherwise I'll try, okay? I always believe that you have to try it yourself or your loved ones, okay? But don't give too much testosterone for your wife. Otherwise you lose control of everything at home, okay? That is a problem with andropause, you know, because they maintain their testosterone level relatively well. They lose their progesterone and estrogen. You lose your testosterone. After the age of 50, maybe 60, andropause, then suddenly the boss in the house changes. Yeah, so the dressing also might change. That's the problem. Anyway, where was I? So I was treating myself with all this. I wasn't getting well. And when I started introducing nutritional therapy, then I felt better, but it plateaued. That's when I realized that hormones are also very important for health. So it is a long process of learning and experimenting and then finding, it may not be the best solution, but it is a solution that has helped me a lot and many, many, many of my patients.